Open your eyes, please. Wonderful. So here we go. You can see the m.o.i.s ICL in place right there. See that? See the positioning, everything on par there. No stitches, open wide. And imagine that's a keratoconus eye where he was left blinded, right? Sit back. So Simpson, you come in here, again, brief history in 10 seconds. Quick, go.
Yes, coming from New York, I've seen several doctors, some of them are top specialists in New York City. Always stand down and they cannot do anything besides waiting until I getting very old and to do transplant. And now, finally, I can see with Dr. Gulani, so everything starting to get better for me. So yesterday I had the surgery, and today is something else. I told my wife while we were on our way to come here, I started seeing signs outside, see chase bank, things like that, and that was wonderful. And I know my vision is not settled down yet. I cannot wait for the full picture. And thanks to the GOAT, Gulani.
Well, Aisha, my daughter's here. It's a pleasure for her to be here, for me to have her here. Today she's seeing all day one patients. Yesterday she said we operated for 12 hours. We were here. Every patient had come from all over the world, and here we are. So I'm letting her see what I show doctors all the time, impromptu, day one, no pain.
Yeah.
Here's another important thing you missed. When I teach doctors, I let them know, this is his only seeing eye.
Yeah.
It's the precious eye. He's blind in the left eye. This is his only seeing eye. In that eye, after a lot of back and forth, remember?
Yeah.
Because as you know me, I'm very strict about what we do. We went back and forth, we explained the risk. And it's a very high keratoconus with previous techniques in New York that did not work for him. And we put in an m.o.i.s ICL, and the way I do this is LenzOplastique. So now you understand, Ash? It's the optics, how we play with. Any surgeon can put the technology in or call themselves expert. That's not the point. How you make the patient see, and the highest accountability is patient on camera. Nothing else. Everything else you can fool around with. Patient on camera will never lie. And that's him. And see how they speak, the knowledge. How much have you researched me? You guys taught me for years.
Yes.
He knows everything. Everybody knows everything.
Yeah.
And then they come here, and then we have to perform for them. So day one, any pain?
No pain, no
Fantastic.
pain. No.
Advanced keratoconus, only seeing precious eye, and he's already seeing.
I would not even call it seeing precious eye. This so-called, because the eye is not good. It's not even good.
And even that I wasn't seeing. You're right. You're right.
Yeah. So according to them in New York City, that was my only precious eye. But for Dr. Gulani, now I can consider this one as a precious eye because I can see now. So,
and another thing I show, every eye is precious to me. That's my other teacher,
yes.
right? Son.
Thank you very much.
Love it, man. Love it. Sonia, how do you feel?
Good.
Yes?
I feel great.
Any pain at all?
No.
Super. Quick history. Sorry, my daughter's watching. Aisha's in the room, and this is day one. You saw all these cases. We worked 12 hours yesterday, right? Surgeries on patients from all over the world, very complex. Quick, your history. You had 9 surgeries before, along with your RK. Go.
My history, I started with RK surgery probably 20, 30 years ago. Saw great for years. Left eye was 20/25, right eye was 20/30, overall 20/20. And then after about 20 years, my right eye started going back to reverted back to what it was, where I couldn't even hardly make out the big E.
Sonia, faster. I just want to go through, had multiple surgeries, saw multiple surgeons, boom, boom, boom. Because that shows the pain part. Go.
Had multiple surgeries with RK surgery. I got to where I just couldn't see anymore. And coming to Dr. Gulani was wonderful. At least I finally got to see a doctor that would at least see an RK patient that had multiple surgeries and multiple mistakes from the surgeries.
Again, your experience with other surgeons, other officers.
Oh, other surgeons, other offices. They said I had keratoconus, which I did not have keratoconus. Another doctor fitted me with scleral lenses, which is really hard to wear because I have severe dry eyes. Came to where I live down in Fort Myers, saw another doctor who thought he could clear up my scar tissue. That didn't work either. Got kind of a weird cut towards the bottom of my eye. So luckily now I can see again, and hopefully I was correctable after Dr. Gulani did my first surgery. Before I wasn't correctable at all, and now doing cataract surgery and just waiting to heal up and look at my better vision.
So for doctors watching, Aisha, as you saw, Sonia had come to us with multiple. She's had 9 surgeries on her cornea after real keratoconus, went into ectasia, 16 diopters, regular astigmatism, all that stuff. What we did is LaZrPlastique. We took her from these scarred areas and we brought her to complete clarity and, more important, measurability. Right, Sonia?
Right.
Then I sent her back to her eye doctor. They measured her and they were blown away with the fact that she's measurable. Now we did LenzOplastique yesterday, lens-based. You saw the surgery, no stitches, despite the very ectatic area and scar, and the area now cleared. And here she is, day 1. Any pain? So that's how, again, no patient you can give up on. All of them are possible. And see how intelligent they are. They've seen, how many surgeons have you seen?
Quite a few.
And all over the country. And she goes back to South Dakota. So amazing. That's such a pleasure. And you're seeing today, day 1, all of them. Right, Sonny?
Yes. Especially
pleasure.
going to Baskin Palmer, where they wouldn't see me. Nobody would see me in Fort Myers either. It's sad. Then you just search the internet until you find somebody. Found you.
My pleasure. My pleasure. So if you take a look, Aisha, see, this is a great camera shot. He looks amazing. Look at him. Come take a look. So this gentleman, see that? Extreme myope. You see the exact toric lens, see how the axis is? Right? And see how it's sitting perfectly surrounded by the capsule. No stitches. How comfortable are you? King Kong?
Yes. Very
Yes?
comfortable.
How's the vision already? Even though day 1.
Yeah.
Amazing, huh?
Yeah, man.
So happy. So again, his case, Aisha, all patients today were flying out, but you see these cases. These are patients who had no way out. Every doctor they see says nothing can be done because extreme myopia, extreme astigmatism, very thin cornea. We were deciding between 2 different things, and we decided to go LenzOplastique. So he's done forever. And today is day 1. Any pain? How was the experience in the suite?
No pain, no issue. Sleeping on my back was difficult.
Shut up! Shut up! Do it for one more day.
I'm a toss turn guy.
One more day.
But yeah.
Lovely. Come, let's
That's the
go.
only reason.
So, James, what we do today, since everybody flies out, this is where you'll really see the magic of this institute. Is each one, when you come in, it's 1 at a time. Suddenly 30 people will fly. So go in the back, they're all sharing their stories. Once you're done, we'll see you again. Come.
Okay.